This is Rose Huran and her husband Ron. Rose is 73 years old and has chronic obstructive pulmonary disease, COPD. She lives in Alliston, Ontario and is a patient of South Simcoe and Northern York Region HealthLink in Central LHIN. HealthLinks is a new model of care that makes it easier for people that rely on our system the most, such as seniors and people with complex medical conditions, to access healthcare in Ontario. HealthLinks is centered on one simple concept: physicians, specialists, hospitals, home care, long-term care, and community services working together to better coordinate care for the benefit of the patient. This is the story of HealthLinks through the eyes of the patient.
I have COPD. It's my own fault I have COPD because I smoked for years and years. Just after Christmas, I think, or I couldn't breathe. It was terrible, but I was really scared. I think I was taking panic attacks. I think that's what I was doing. I was in there for 5 days. I had a little episode in August, but it wasn't near as bad. They kept me in for a few days again. And that's when they started talking about setting me up on this HealthLink. And that now our doctor is involved, and she even comes to the house. We have met so many wonderful people. We really have the nurses.
Healthcare with you couldn't beat them.
Yeah, through HealthLink, we have all kinds of people.
Super people.
Call to see how we're doing, or we can call them if we need them.
We got set up with our drugstore too.
Yes.
We just phone them and they put her on antibiotics, whatever she needs. Mm-hmm. We don't even have to go to the doctor. It's
monitors me every day, and I like when I do it, so that it doesn't put me in a panic if I'm having trouble. Some days I use it every day. To go on to the next thing, and it's my oxygen. I would describe it as an excellent thing for people like me. For me in particular, it's very, very good.
For Rose, as I said before, she wouldn't be here if she wasn't for help. I don't think she would have been, because if you went over to the hospital half the time, you wouldn't get in anyway because it's full, that waiting room. But
so from your perspective, Ron, what has been the greatest advantage for Rose and for yourself too to be in the HealthLink?
Just protecting us. We know there's somebody there if we need them. Like our doctor, she comes in, sees what's wrong and tells you, gives you a prescription or whatever. And before we had to go to the doctor, but she comes here, so it's perfect. It's the greatest thing that ever happened to the healthcare.
Very happy with it.
Would you recommend those services to a friend?
Yeah. I think they're wonderful. But I'd panic before. Try to keep myself calm so I don't panic.
The doctor has to give you respect the same as you respect the doctor. Some of them don't even talk to you.
Communicate with you, and have a more pleasant bedside manner.
Not knowing what's wrong with you, I'll say. You can go to the hospital, you maybe lay there for a couple of days before they tell you anything.
Communication is definitely one of them, the big one.